Welcome to Surf Strong Elite, Conversations for a Healthy Surf Community. I'm your host, Greg Finch. Before we dive in, I want to let you know that these episodes will either stream or be recorded live on YouTube, Facebook, and Twitter. So we encourage you to join in, ask questions, make comments. If you follow myself, Greg Finch, or Surf Strong Fit on any of those channels, you can participate in the conversation and ask questions. We encourage you to do so. It makes the episodes dynamic, interesting, and reach more of the surf community. Today's episode of the Surf Strong Elite Show is with Michael Rintala. He's a chiropractor based out of San Diego, California, and is an expert in DNS, or Dynamic Neuromuscular Stabilization. And he takes us through a lot of really practical applications of DNS. As we talk about in the episode, DNS, the well is really deep, and some of the concepts can feel difficult to connect to in the beginning of the practice of it. So we really focus on some real practical applications to get into DNS. And our hope and our focus is to kind of plant that seed with you so you continue on pursuing the concepts in DNS, which are really powerful and are great for complementing any other work that you're doing on your own with other health and fitness professionals. It really helps assess and check in on what you're doing and where you can improve. He'll take us through a 3-step breath check-in and protocol to see how well you're connecting to your diaphragm and really feel it descending down and the intersection between the diaphragm for breath and stability. Let's get to our conversation with Michael Rintala. Hi, Michael. Thanks for joining us today. I really appreciate you taking the time and sharing your expertise today. So we kind of just jump right into it, and what we're going to talk obviously about and your expertise is dynamic neuromuscular stabilization. So there's so much history there, and there's so much depth of knowledge that you can offer. What I'd like to kind of start with is just, when did you first hear about DNS, and how did that kind of come about? And that'll tell us a little bit about your personal connection to DNS.
Right. So the formal name DNS didn't come about till, I want to say, around 2007, 2008. Prior to that, when I first got introduced to Prague School of Rehabilitation, that's where dynamic neuromuscular stabilization concepts and principles were developed. But I first got introduced to Prague School in 97 when I was in chiropractic school, or chiropractic college. And there was an instructor, Dr. Liebenson, who introduced kind of the founders of Prague School of Rehabilitation, Carl Levitt, Professor Yonda. So that was the first time seeing Prague School, getting introduced to the concepts and principles that were there at that time. And then as far as the introduction or seeing Professor Pavel Kolaj, who is the developer of DNS, that wasn't until 2003 when I took a trip over to Prague and saw him for the first time, talking about his ideas and his approach to assessment and treatment.
And at that time, when you met him during that, obviously he's been developing a lot of these conceptual things and putting them into practice on assessment and maybe working in a clinical setting. Did he have a kind of a a formal idea of where this could go? Did he want to see it kind of advance that way in a structured place and start to get? I'm sure he wanted that knowledge to be shared, but did he have a vision for what it could become?
Uh, that's a good question. My thought is probably yes. When I
Uh-huh.
first went over there, um, you know, we saw this was 2003, and it was a bunch of different Prague school therapists, neurologists, um, lecturing and demonstrating, and it was like a 7 or 8 day uh, series of presenters, and the last 3 or 4 days was Professor Pavel Kolaj kind of introducing these concepts and principles. And Professor Kolaj, he's a pediatric physiotherapist, but he also sees general population, and he works with high level athletes. So at that time, it was all translation. So it was Professor Kolaj, and then he had Elena Kobasova, who's a neurologist, translating for him. So it was him talking about developmental kinesiology, lots of showing infants and the developmental process, and then showing how the knowledge of that developmental process can be applied to assessment and treatment to the general population, and especially the athletic population. So it was basically at that point his ideas and what he was doing with his uh, patient population, which included the newborn, all the way up to the elderly. But a huge part of it that really interests me was the application to the active or athletic population. So that was seeing him present that, and seeing how he was applying it was it was an eye opener for me. It made total sense. And then from that time on, I kept going over there. They finally started coming over here, and it's progressed to where it is today.
Yeah. The one of the things that's interesting about it is it kind of dived into a little bit of the history, and like you said, mentioned as kind of a formal structure of really the last 10, maybe 15 years. On the scope of things, that's relatively new. So having that formally organized where maybe a lot of awareness isn't out there yet, what one is the most exciting part of that is being able to expand this knowledge and share it with professional athletes and general population. And then two, what's the most problematic or frustrating aspect of that?
Um, okay, so number one, the exciting part of it, yeah, it's in the scheme of things, it's relatively a new set of concepts and principles. And the exciting thing, just when I was first introduced to it, and then when it finally became organized as far as um, being able to teach it formally and have it structured, um, the exciting thing was the ability to apply the concepts and principles with everything else that I was doing, how easily it fits into the good work that we're already doing and enhances it. Um, uh, the also exciting part is that it's constantly evolving and improving, and Prague School is constantly evolving and improving on how to apply it, how to teach it to um, movement specialists, clinicians, so that they can help the people that they're working with. The problematic aspect of it is that it is new. It's not widely known, even though it has grown exponentially in the past 10 to 15 years. It's really only scratched the surface as far as people's knowledge and people's ability to start applying it. So that's frustrating, but then it's also the potential is there for more and more exposure, more and more evolution, and uh, application of the DNS concepts and principles.
Yeah, the frustrating part there really is at the center of it is, of course, the opportunity. And the excitement
Mm-hmm.
kind of flows right back into that. So when you're doing, let's say you're doing some, some of your workshops, and you have a collection of professionals coming to. Let's just say it's an introduction to DNS to the working professionals. I imagine that those professionals would be pretty vast in one, the population that they're working with, and two, maybe their backgrounds and where they come from. So where is how does that come into how you then are teaching it? Do you obviously you're starting this intro certification, let's say, so you're really starting from the foundational movements of that, which we'll talk about here in a second, just to get some conceptual
Mm-hmm.
ideas out there. But is that fairly easy to come from a broad background professionally, and for you to then convey this to the individuals that are then going back and working with those diverse populations, or is that tough within a workshop setting?
Um, it really comes down to the individual practitioner
Yeah.
and their experience, their biases, or lack of bias. There's um, the way that the coursework is structured. There's a specific exercise, sport series of coursework.
Mm-hmm.
There's a specific clinical series of coursework. There's a specific pediatric focus as far as the coursework, and then there's specialties off of that. So, um, the depending on the audience, like that first one, the DNS exercise sport series, that is usually a combination of clinicians and movement specialists, strength and conditioning specialists, coaches. The idea there is to get them all in the room because they should ideally be thinking alike and communicating. And if they are, that best serves the people that they work with. Because usually, especially with athletics, we use that as an example. You have your coach, you'll have a strength and conditioning. So you have the coach as far as technique. You have a strength and conditioning person, and usually you'll have a clinician working with them as well. So if they're all on the same page as far as what we're looking at and what we're trying to do with the person that we're working with, then that's going to help them reach their potential. And whether that's performance or rehabilitation. So in that instance, usually we have a combination of the strength and conditioning people, the clinicians. So my approach there is giving the basic foundations, the concepts and principles, showing how they can apply to each person's scope, and then showing how they can all work together. With the clinical coursework, it gets a little bit more. There's still the assessments and treatment and active exercises. Where in the exercise sport series, it's assessment and active exercises. We do talk about manual aspect of things, but more the manual aspect and clinical aspect is saved for the clinical series.
Mm-hmm.
So
yeah,
kind of
keeping them within their backgrounds allows you to then focus on how they'll best apply those things back to their athletes, and that does, of course, makes sense.
Yeah.
So if you have,
so I try to,
Oh yeah, go ahead.
I was just going to say, so I try to show how each person can apply it best with their background and their experience.
Yeah, the most focused application for them. That they'll get the most out of that time with you to then be able to apply it back to their clientele the most effectively. So if you, in your practice in San Diego, So let's have a. I'm just going to give you an example, and it's just kind of interesting to see what the process would be for somebody coming in that's dealing with some pain. So let's just describe a surf athlete coming in. So they're 45. They've been surfing since they were in their 20s, and they're not surfing as much now, and they're starting to deal with some shoulder pain. Maybe some low back fatigue, just some general just not feeling like they're really clicking in their surfing anymore. And they come in for, I imagine that you start with an assessment. Just kind of walk us through what that process would be of kind of getting deeper and identifying what their real issues are through DNS.
Right. So uh, usually if they're coming to see me, it's because they are in pain. So um, although more and more as people learn about DNS, more people are coming to prevent pain and enhance performance. But the typical, let's say, 40, 45 year old surfer comes in. One, I'm going to get a general history about what's going on and what the issue is for them. And then with DNS, um, usually before I do the dynamic neuromuscular stabilization assessment, I'm going to go through ortho tests, neuro tests, but then I add the specific dynamic neuromuscular stabilization assessments, which will give me a fuller story as far as what's happening with their body and their quality of movement that led to the specific problem. So with DNS, one of the main things assessment-wise that we look at is the synergy, coordination, and timing of the deep stabilizing system of the spine and the whole movement or kinematic chain. And a big part of that is looking at the function of that deep stabilizing group of musculature, which consists of diaphragm, pelvic floor, the entire abdominal wall, the intersegmental spinal musculature throughout the spine. And so through a series of different movements that I have them go through, I'm looking at that efficiency of that deep stabilizing system, the timing of it, the ability of it to work together to create an ideal stability through the trunk and pelvis, which then influences the whole chain of movement. And it's not just stability, but it's also the ability of the diaphragm, which is a huge component of that, to coordinate between respiratory and postural function throughout dynamic movement.
Can you
So
talk a
I'll
little
look
bit?
at
Can you
that.
talk?
Yeah.
Can you talk a little bit more about that idea? So first of all, is there without going too deep into DNS, if a listener is trying to identify that concept right there for them, so they're trying to identify their diaphragm and how that intersects between respiration or breath and stabilization through the movement. What's the best way for them to start, like right now, if they're sitting or standing, to try to identify what that feels like and then be able to go deeper in that? So how to identify their diaphragm and how it's interacting between breath and movement?
Right. So the first thing is just to look and try to feel how you're breathing. The breathing is a huge, probably the biggest component, because when we take a breath in, ideally the diaphragm's going to drop down. When it drops down, the lungs expand and the air comes in. So as I take a breath in, with the assessment or just on myself, what I can do, I can literally put one hand on my chest and I'll put one hand below my belly button. And it helps to close the eyes. If you close your eyes and you take a breath in, see where that breath goes initially. So if I breathe in, ideally, I'm going to feel my the hand just below my belly button expanding. If that's happening, that tells me that my diaphragm as I breathe in is dropping down and the lungs are expanding and that air is coming in, and I'll feel the lower hand, the hand on the belly, kind of move forward. If that coordination, that synergy, or that activity of the diaphragm being able to descend is compromised, then what tends to happen is, pretend this hand's on my belly here, is as I breathe in, I may start to feel this hand move, but the default will be the thoracic cage in my chest will move up towards the head. When that's happening, that usually tells me that the diaphragm is being inhibited. So as it starts to drop down and descend, it's unable to do that. It could be structural, it could be nervous system. But if the diaphragm's unable to drop down and the lungs are unable to expand that way, then my brain will find a compensation. And usually that's the accessory breathing muscles will kick in. And they'll lift the chest to try to get the expansion of the lungs. So it's a kind of a compensatory mechanism with the respiration that will kick in, kind of like a survival compensation for the central nervous system. So when things are functioning nicely and the synergy, timing, and coordination is there with the central nervous system and the facilitation of the diaphragm descending, then that diaphragm's dropping down, the accessory breathing muscles, if I'm just sitting here, are relaxed, and the diaphragm's doing most of the work. When we're active, and we need, the diaphragm's working nicely, but we need more oxygen, then the accessory breathing muscles and the diaphragm descending will work together, and our thoracic cage will expand nicely, and the lungs will expand nicely, and we'll get the oxygen that we need. If I'm just sitting here and I breathe, and first thing, the accessory breathing muscles are kicking in, then that's a sign that that compensatory high threshold pattern has taken over. And we breathe about 25,000 times throughout the day. So if that pattern has taken over as far as my respiration, sitting on my computer, driving my car, then everything is, each breath is here. And with that, you'll see hypertonicity in the neck and shoulder fixators. And also that can tie into your autonomic nervous system, fight, flight, or rest, digest. So it has implications there. But then also looking at the breath and seeing where it's going. If each breath, my accessory breathing muscles are doing all the work and my diaphragm's unable to descend, that's also going to affect my stabilizing function. Because if I'm not breathing and I go to lift a weight, or I go to lift my leg off the ground, my central nervous system will also have the diaphragm descend. And when it descends, it creates an intra-abdominal pressure. It loads pelvic floor. It loads the entire abdominal wall. And if I lift the table, if I go to lift a weight, if I'm popping up on the surfboard, doing a bottom turn, my central nervous system needs to coordinate between breathing, but then also stabilization. Both of those require the diaphragm to be able to drop down and descend. And if the breathing function is compromised, usually 98% of the time, the stabilizing function is compromised. So on yourself, if you just do that and you see that the breath is up here and you're just sitting there, now when you're paddling, when you're popping up, whatever you're doing on the wave, the tendency is going to be that a high threshold pattern is taking over, which will allow you to do what you need to do, but uh, it's a high threshold pattern, which means the synergy, coordination, timing of that deep stabilizing system is not kicking in. And that high threshold pattern will allow you to do what you need to do, but there's a cost. And the cost is wear and tear throughout the kinematic chain. So if that's compromised, you'll tend to overload in the low back region, in the thoracic lumbar region, in the cervical thoracic region. And that will also create overload throughout the whole chain of movement, from the foot to the hand, whatever the motion may be. So you can use that high threshold pattern, but what I see clinically is that it tends to start to catch up with us late 30s and 40s. Just it seems to be the timing of life and culture. That's when people come in. Maybe the low back's hurting, or the hip, or the knee, or the shoulder. And it's usually, if it's not an acute injury, meaning you didn't wipe out and get slammed into the bottom, into the sand. If it's something that's slowly over time and accumulating, that high threshold pattern is usually taken over and has caused increased loading in certain areas throughout the chain of movement. And now you're wondering, why is my back hurting? Why is my neck hurting? Why is my shoulders hurting? I'm not surfing as much because that's hurting. How do I keep surfing and not hurt or not progress that wear and tear?
What a domino effect. I mean, so tied back to
Yes.
that breathing component. And what a great explanation of the intersection between how that stabilization and the inefficiency of your breath, which goes to so many different avenues: ability to recover post surfing session, the efficiency of your breath within a session, putting yourself potentially into dangerous situations because that compensatory breathing is so inefficient that you're not getting that deep recovery. You're not getting into that place. And
Yeah.
how often do you see across the board, surfing specific, but also just across general population? How often do you see in the clinical setting somebody coming in that is living in that compensatory place with all of the things that come with it, stress through the neck and cervical spine, that perhaps was a learned behavior from an injury that maybe happened 10 years ago, but they've just stayed in that compensatory state forever, where the injury maybe isn't really existing or impacting them anymore, but they're just living within that compensatory breathing pattern?
As far as if they're coming in with any type of pain or injury, it's almost 100% of the time it's a factor.
Wow.
And going, the things when uh, we're first born, our central nervous system is still immature. Structurally, we're still immature. As that central nervous system matures, at certain points in development, there's certain developmental milestones. There's inborn hardwired motor patterns that are expressed. So you see the infants start, they're on their back, they're on their belly. Eventually they can turn over, eventually they're crawling, then kneeling, then squatting, then standing, and eventually walking. All that with a healthy central nervous system maturation is expressed at certain times during the developmental uh, sequence or developmental kinesiology. And so we all still have those hardwired patterns. But what happens over time, there's certain things that can throw off that synergy, coordination, and timing. One, postural habituation. What do we do at like 5 or 6 years old? We start going to school, we start sitting for long periods of time. So there's postural habituation that can throw it off. There's also repetitive uh, movements. And then the third thing that can throw it off is past injury. So usually with active people, you're dealing with all three. And if we think about adults, let's say, um, a surfing athlete who has a day job, they're not pro level. You have postural habituation. You've been sitting at your desk all day. Repetitive movements with the phone or the mouse. Then you go out, and surfing's your go-to exercise. Paddling, popping up, all those are repetitive movements that we do over and over. And then if those two are compromising the quality of transfer of force and load throughout the chain of movement, now you start to feel your knee or your hip or your low back because those areas are getting overloaded. That pain that you feel now factors into the timing and synergy of that deep stabilizing system to function properly. Because with pain, you're going to go into more of that compensatory pattern. So then it's like this downward spiral that just keeps accumulating. And a lot of times people are like, oh, my back's hurting. Well, I got to get stronger. So I'll do more sit-ups.
More load.
They'll add load, but what they're really doing, they'll get stronger, but that underlying compensatory pattern is still there.
Yeah.
So they'll have this strength bump, but then it's just adding to the wear and tear, and then it's tends to get worse.
And then that reinforces the negative of all the work that they just did. I just worked all this last few months and did all this workout and got stronger, and I'm worse. So it's reinforcing the negative too.
Like I'm stronger, but I hurt more, and now I still can't surf. So so that's the typical scenario. Then that's when they tend to see me.
Yeah. So if how deep the well of that DNS is, we obviously can't even start to scratch the surface in the time that we have today. But if you had to talk about either a practical movement pattern for somebody, a surfer that's listening, tied into their breath that we just talked about, that idea of using your diaphragm to help stabilize. What's one good movement pattern or a few that they could start to experience this feeling of the breath and the alignment and some of that coming out of that compensatory breathing pattern that someone could try right now today and start to get some of those concepts going?
Okay. Biggest one is the breath. And if you want, I'll take you through a little.
Yes, please.
Something that I tend to give each patient. So one, if you just go to this, you recognize that not a whole lot's happening here. Everything's coming up here. Then one, if we can start to normalize the pattern of respiration, the activity of the diaphragm, almost automatically the stabilizing function starts to improve as well. So just a little take home for everybody, and then also something that I tend to show my patients as well, is if you recognize that coordination, that ability of the diaphragm to drop down and descend is compromised, 3 things you can do to help facilitate better activity. And also, if you are dealing with pain, and it's consult your physician, make sure there's nothing, it's not just respiration, there's nothing else going on. So just always check that out. But here, one of the first things, if I take my hands and my thumb and fingers and I put them, so I have my hip bone here, like my ilium, and then I have my rib cage. If I come in between the rib cage and the hip bone or the ilium, and it's almost like you're like sandwiching the abdominal wall here, which wraps all the way around. So if I take my hands and I push in the abdominal wall and I squeeze the fingers a little bit, it helps with my awareness here. So one of the first thing I'm going to do here is I'm going to breathe in through my nose, and I'll usually give them a breathe in 2 to 3 seconds in, 2 to 3 seconds out. As I breathe in, I want to have the intention of breathing in and feeling my hands and fingers expand. If that's happening, the diaphragm's dropping down. My intention is breathing down towards my pelvic floor. So if I can get the diaphragm dropping and descending, I'm going to feel this expansion 360 degrees into my hands. So it's a great way to start the awareness, to feel, can I actually do it? Or is it starting and then everything comes up here? So that's usually step one. If that's too much, we go to here and here, and I have them try to keep this hand quiet, the top hand quiet, and then breathe.
And that's back to where your hand's on your belly button and your top hand is almost on your chest.
Yeah. Here, so this is kind of like an easy starting point just for awareness. But when that diaphragm's dropping down, a lot of times if my hands are around the trunk area, people will breathe, and this will be the belly. They'll get the belly part. They'll quiet the accessory breathing muscles. But what we really need is the 360 to the whole abdominal wall, which wraps all the way around. Too often you see belly breathing, but if nothing is happening in the posterior lateral, in the back part of the abdominal wall, then that musculature is just shortening and tightening. It's compressing the low back, and every movement you do, especially paddling, you're just kind of beating up the
more tension, more tension.
So, yeah. So this one here, breathing in, 2 to 3 seconds in, 2 to 3 seconds out. As you get better at it, you can go 3 to 4 seconds, 5 to 6 seconds. You can increase the duration of the breath in. So that's a big one. The second part of that is if I give myself a hug and I put my fingers in my rib spaces, the lower ribs, your diaphragm attaches to the lower 6 ribs. So if I put my fingers in those rib spaces here, and I give myself a hug, now, not only do I want the diaphragm dropping down, having the intention of breathing to the pelvic floor, expanding my abdominal wall, but I want to feel the expansion of the ribs. So I should feel my fingers, the rib spaces expand as I breathe in. So this is a really nice one. This is usually an area where there's not a whole lot happening here, and they'll feel their shoulders come up. So if I breathe in, what I'm feeling is my fingers moving apart. And then the third aspect is, the thoracic cage comes all the way up here. Our ribs come all the way. There's first and second ribs that attach to the scalenes, which are accessory breathing muscles. So the last part, if I put my fingers kind of in my armpit here, my thumbs on my pec muscles, relax the shoulders. Now, when I breathe in, I can feel again my fingers. I can feel those intercostal spaces expand, and the ribs are expanding horizontally. So initially, we can talk about this, quiet the accessory breathing muscles, and trying to get the diaphragm to drop down. Second, if we go here, now we're promoting 360 degrees of expansion as the diaphragm drops down. The next one here, and I want to promote the ribs spreading apart. These bottom ribs, they kind of move like a bucket handle. They spread apart and expand as the diaphragm descends. And then the third, fourth, whatever part here, we want the whole thoracic cage expanding to get the air into the lungs to supply the body. So the third component here is whatever component is feeling that whole thoracic cage expand. If we get that, then we have nice function of the diaphragm, and then again, almost automatically, the stabilizing function will kick in. But if that's compromised, instead of this nice expansion of the thoracic cage, all the muscles here pull my thoracic cage up, overload the cervical spine, overload shoulder, and it's a big component: neck, shoulder, low back issues. So that's always one of my first go-to or home exercises that I'll give patients to start working on.
Yeah, that's a fantastic introduction of the progressions of all of the pieces of that, of physically touching the connection between those and practicing that in repetition. And is it fair to say that if you're checking back in with that and really improving that ability to use that diaphragm, to allow it to descend, to get that expansion, more efficiency in your breath, is it fair to say then that the way the compensatory breathing system works is it's almost like the last gear? If you're in a place where you're working really efficient through your breath, then if you need that, you can kick into that place and have that little bit more that you might need, whether it's an emergency or a way to recover for something that's a high stressor.
Yeah. So it's a good question, because we have a certain functional capacity with our central nervous system to facilitate that efficient, ideal pattern of both breathing and stabilization, the coordination between the two. But the nature of especially training and competing is to push past that. When we push past that ceiling of functional capacity, we fall into what we call the functional gap. And that's where we'll kick in the compensatory patterns to help us complete the task, whatever that may be. Again, popping up, or we're throwing a ball, or playing basketball. Getting that extra, going beyond what we're capable of, performing with that ideal pattern where we have nice ideal transfer of force and load and less wear and tear on the passive structures throughout the chain of movement. What we see again with training and competition is, especially active people, we push into that functional gap all the time. And that's okay. Our central nervous system is designed for that. It's kind of like, I tell my patients, I'm like, it's kind of like, the caveman brain. If I'm getting chased by a dinosaur, I know the timeline isn't right, but if I'm getting chased by a dinosaur, I'm a caveman, then my brain doesn't care how I do it. I'm finding a way to get out of there.
Yeah.
My legs hurt. I'm limping, and I'm finding a way. So it's a survival mechanism, and it's okay to go into that functional gap. The problem happens when, if everything we do is going into that functional gap, if we do that enough, that compensatory high threshold pattern becomes the go-to for everything. When I go to pick up my phone, when I'm typing, instead of this and here, it's like a really low load activity, but I start to come up here. When I'm just paddling out slowly, instead of this nice, facilitation of stability and nice positioning of the joints, automatically right away I'm into the high threshold pattern. So that pattern starts to become the normal, or the go-to, and then we start this slow process of literally beating up the passive structures throughout the chain of movement. So the trick is, well, not trick, so the ideal, whether you're a movement specialist, strength and conditioning specialist, clinician, doing rehabilitation, is finding or being able to see and recognize when they're going into that high threshold compensatory pattern, and when they're in the more efficient, ideal coordination of respiration and stabilization. And then either with cueing, the trainer, movement specialist, verbally cueing, external, internal cueing, the right programming, the right amount of weight to help them build that capacity of that functional capacity so they don't have to spend as much time in that functional gap. Clinician wise, with rehabilitation or performance, using verbal cues, manual cues, and also utilizing what we call active exercises to build that capacity is a key component, not just for performance enhancement and rehabilitation enhancement, but that can also then create durability and longevity with movement quality so that people can keep doing what they want to do, whether it's competitively, whether it's recreationally. This can be something that they do for a long time without beating themselves up.
And I would imagine too, if that individual is continually practicing and rechecking back into those foundational movements, breath patterns, staying out of the compensatory, not only is your training more efficient, your movement throughout your day is more efficient, but if and when a more acute injury comes in, your ability to then recover from the acute injury and click back into those foundational movements makes recovery that much more efficient.
Definitely.
Yeah.
That's huge. And one thing, if you look across, especially if you look at sports, if you look at the performers that kind of rise to the top, your Roger Federers, your Kelly Slaters, Gretzky, Messi.
35. That what a great story.
Yeah. One, you see longevity, durability. They get hurt, but they tend to recover quicker.
Yeah.
And if you look at their movement, they're not necessarily the fastest or the strongest, but their movement is so fluid and efficient.
Yeah.
And that's where, when I see that, I see synergy coordination of that deep stabilizing system, that integrated stabilizing system of the spine, on top of, so they have really good fundamentals of movement and synergy coordination, timing of deep stabilization. And then with those athletes, they also have really good cortical function, body awareness. You combine those two, and you see, again, you see them rising to the top and staying there for a long period of time. And it doesn't have to be professional, sports. Like all of us, I call us occupational athletes.
Yeah.
We have our day job, and then we're doing our recreational activity. The better that we are able to facilitate that, ideal stability and respiration, then if we do get injured, we recover quickly. But the big thing that I see over time is injuries are less, and people are able to keep doing what they want to do for a long period of time.
You kind of touched on this earlier about DNS starting to get more people understanding conception or knowing a little bit more about it. So you're starting to see a little bit of that pre-habilitation, if you will, coming into pre-injury. So talk about that on the work that you do on the World Surf League when you're at an event. How are you utilizing some of these ideas and these patterns where an athlete is dealing with some, maybe not necessarily acute injury, but you're in that moment. Maybe they have some background in DNS, but how are you kind of utilizing this conceptual right in that moment where they're competing that day or the next day?
Right. So in that situation, when you're basically on the field, wherever that may be, and I've had the opportunity to do World Surf League stuff, PGA stuff, and other on-field type of assessment and treatment. In those instances, uh, if the person I'm working with has to go to compete, then I'm usually utilizing a lot of positioning and manual methods to facilitate that ideal pattern. I may touch on the breath and touch on a little bit of awareness, but in those situations when they have to go compete,
Right.
you don't want them having to. They need to think about performance, not like, am I doing this? Where's my breath?
Right.
So
Is my diaphragm
depending on
descending?
yeah. Depending on the situation, in those instances, usually, ideally, you're working with a team of people and different clinicians, and everybody's on the same page and working together. But for me, what I'm trying to do is utilize the more clinical skills to tap into them being able to facilitate that ideal coordination, to where they don't have to think about it and they can go out and do what they need to do to perform.
Yeah.
Now, if, let's say, they're eliminated from the competition, they lost their heat, and they're like, what was that thing you were talking about? Then I may get more in depth. Or ideally, I see them in the office, and we're doing more of the proactive work rather than reactive work in that setting.
Yeah. Yeah, well, that just pays the dividends long term to be able. It's that then you have space to allow the conceptual to then apply to the practical movement itself, and then that can just be that is it's the seed that then grows, and that's a big part of what I'm hoping people listening to and watching really can take this idea. Your 3 steps through the breath. I'm gonna segment that and make sure everybody can find a place to get to that. So if you are just listening to the audio podcast right now, I'll have video of that you can then see what that is, the concepts, and really start to apply, and letting these real practical checks come into our movement, and we can check back into that and really grow from that, because DNS and how to relearn or unlearn some of the patterns that we've really gotten in our lives. And you touched on stationary work, sitting at a desk. I have a feeling that the mobile phone that is so relatively new to all of us and so ubiquitous now, is going to come in on postural things that are just we're going to see them more and more and more. So the more we can check in, the more we can get down to baseline, if you will. And DNS is such a great place to check, so quick to check in, and then it can go so much deeper. So where would you like, if you looked out, say 10 years from now, or even 5 years, for how quickly it's growing, the concepts, where would you like to see DNS in those 5 to 10 years? What would you like to see on the ground, if you will, happen with DNS?
Ideally, I would like to see clinicians, movement specialists, strength and conditioning specialists, coaches, all kind of working and communicating together and utilizing each other's strengths or scopes for the benefit of the people that we all work with. So, the more people that do the coursework or are exposed to the concepts and principles, then the more communication and discussion we can start to have, and the more we can evolve the work and the effectiveness of the work that we all do.
Yeah.
So,
I think that's what's DNS is uniquely positioned that way, and you touched on this earlier as well, is it's so it's so beneficial on top of all of the good work that's already happening. It's able to support and expand all of that work, and so that uniquely positions it to be a language, if you will, between professionals, and letting that language transfer between the professionals that individuals are working with, instead of they're going over here and working with this professional and doing great work, and then it's over here working with this professional, and they're not coalescing together to then really be exponential benefit. Having a language between clinicians and trainers and other bodywork specialists, that idea, it just uniquely positions DNS to be such a huge benefit going forward.
Yeah, no, I agree. And
You're not going to contradict that, huh?
No, you're exactly right. And that's why, we do the coursework. I try to teach as often and as I can to, spread the concepts and principles. And one of the things with DNS, one of the things that's when people start to learn the assessments and the application, specific active exercises, is it can be a little difficult at first. It can be a little frustrating. Just your audience going through the breathing,
Yeah.
and then recognizing if they're in that high threshold pattern and then trying to change it. A lot of them are going to be like, what the heck? It's not easy.
Yeah.
But it's something where if you put the time in and if you chip away at it, it starts to click and it starts to get easier and easier. It's like learning how to surf, learning how to play golf, starting Brazilian Jiu-Jitsu. You got to flail a bit. You got to kind of get beat up. You got to be okay with kind of sucking at first.
Mm-hmm.
But if you put the time and the consistency in, it gets easier and easier. Your ability to apply it gets easier. With the coursework, it's people can get the concepts and principles, but then they also have to then be able to put the time in. But if you do put that time in, it's very effective, and again, it enhances all the other work that you're doing and all the other techniques, whether it's soft tissue, mobilizing, types of training. Again, it's a great tool to enhance all of that.
What's great about that breathing that we talked about before too is, while difficult to improve on, there's no barrier, meaning you are there. You don't have to go anywhere. You don't have to have any equipment. You just have to have the awareness. You have to take the time to check in. You can do it multiple times a day, but anytime you check in is a ability to be present within your breath, and then take real positive improvement on anything else that you're working on. And that the longer I train, when I was younger, a trainer was all these fancy things and this equipment and doing all this stuff, and they might have been great, and they are, and I still do some of them, but I have gotten to my programs to be much more straightforward, much less simple, if you will. But I've found more and more and more simple, done consistently, very well, translates to almost everything.
Yes, the fundamentals are key, and those athletes that I talk about that have that movement efficiency and that synergy, coordination, timing, and rise to the top. One thing that they do very well consistently are the fundamentals.
Yeah.
So, and over time, my experience with treatment and training and everything, it's like, going through all the different things and the fancy things and stuff, I've come to that same thing. It's showing people how to do the fundamentals well and consistently. And that one thing, just going back to the breathing
Yeah.
sequence and exercise, we're really training, and with DNS, we're really training the central nervous system and helping facilitate or express those movement patterns, those efficient movement patterns that we still have up here. Um, when you are practicing that, usually I'll tell people just do 3 to 5 breaths at a time. And if it gets easier, add length to the inhale and exhale. Usually 3 to 5 breaths, you'll get through it in 2 to 3 minutes. When we're training the central nervous system, more frequent, consistent bouts of that exercise are going to help integrate into the central nervous system more efficiently. So we're using initially cortical function, body awareness, but if we do that consistently, it starts to integrate subcortically, which is where then we don't have to think about it. We can just do, and now we're in that pattern versus this pattern. So that's a key component to when you're working with people and when you give them things to do at home.
Oh, that's great. And one thing that's really I think can be really eye opening for myself and people that I'm working with is when you are overwhelmed in life, stress, whatever, there's all of this stuff. We're just constantly inundated with so much information and tasks to do and everything. The ability to be able to click back into a real fundamental moment that pulls all of that distraction away, and you also know intellectually is pushing the needle forward on your improvement, whether it's performance or rehabilitation. That is extremely comforting to be able to know, like, okay, just for these next 2 to 3 minutes, I'm just going to focus into this functional application of my diaphragm and my breath, and it pulls you right into that moment and gives you literally a breath. Take a breath and a moment to then go back into with a clearer mind, clear concept on whatever is in front of you.
Yeah, because you're, especially with the breath, but then also facilitation of that synergy that I talk about
Yeah.
is you're tapping into the autonomic nervous system. So autonomic nervous system, you have sympathetic fight flight, parasympathetic rest digest, and so often, especially when everything's here, we're in sympathetic. So if you can facilitate that diaphragm, you balance that out. Parasympathetic, sympathetic, and now you can actually focus. So with athletes, it's a huge component. One, the breath, but then when we get into the specific active exercises based off of developmental kinesiology, one, you're combining mobility, stability, coordination of respiratory postural function, and that has a great balancing effect to the autonomic nervous system to help then with the focus and awareness and attention for the task that needs to be done, whether it's surfing, baseball, soccer, whatever it may be. And that's where, especially my athletes, we deal with the issue, the pain issue, we facilitate better synergy coordination, and then we develop a specific movement preparation sequence, almost like a flow, to not only address mobility, stability, but address the central nervous system and autonomic nervous system as well.
Yeah, that's great. Do you have any books that you tend to gift to people the most, and why those books, if you do?
Um, I mean, clinically, usually I'll send people, specific articles or research articles on DNS talking about, concepts and principles and giving examples. And I can send some to you.
Yeah,
Post
for sure.
them. I mean, off topic as far as life.
Yeah.
The two books, I guess, that influenced me most that I sometimes will give to people I recommend is Zen and the Art of Motorcycle Maintenance. Piercing is the author, and the other one is Joseph Campbell, Power of Myth. So going off into kind of Zen and Power of Myth is looking at all the different religions and cultures around the world and recognizing patterns in their gods or myths. It just shows how, regardless of culture, and we're all humans, we all have these different patterns. And so anyway, that was one that influenced me growing up, and same with Zen and art and motorcycle maintenance.
Nice. And we'll have in the show notes, I'm going to link the breathing pattern video. I'm going to do that. A lot of the concepts that we talked about, I'll have in the show notes. But for everybody that's just listening, where is the best place to find you online?
There's a few. I mean, one, Instagram and Facebook. My Instagram is Rintala Movement Flow. Facebook, I think same thing.
Yeah. And I'll link those on the show notes for sure. For people.
Mm-hmm. Website, rintalachiro.com, which shows upcoming coursework and I guess a little bit more about me. Mm-hmm. And then there's also another one with my wife, who's a trainer and specializes in the DNS active exercises. That's rintalamovementdesigns.com. And I can send you that stuff as well. So great. A couple different options. People could email me as well if they have further questions.
Great.
So I'll send you that as well.
Michael, thank you so much for taking the time. This has been great. All of those concepts, like I said earlier in the show, DNS is such a deep well, and within this hour, we really are just touching the surface of it. So all those links, people can go find more about that, but keep up all the great work. Every time I go back to one of those movement patterns that I learned when I was at a live training with you, I click back into those and I'm like, okay, yes, I have to keep these back into my pattern. They're so practical for getting back into that moment. They did really just so strong foundational. So thanks for all the work and thanks for taking the time today.
Thank you for giving me the opportunity to talk about it.
Oh, great. Thanks.
Thank you for tuning in to the Surf Strong Elite podcast. Everything that we touched on today will be available in the show notes. You can find those at surfstrongfit.com/podcast. Please subscribe, like, comment on this episode and all of our social media channels that you can find at surfstrongfit. It helps us reach more surfers, and that is our goal, to help surfers stay strong in the ocean till their last breath. We'll see you next time.